An Introduction to Body Fluids, Chapter 14. Under normal conditions, circulating blood, urine, and body fluids from various cavities is considered sterile. So some of the main ones that we'll talk about are the more common ones tested in the lab, which is cerebral spinal fluid, or CSF, which is any of the fluids surrounding the brain down through the meningeal layer, all the way through the spinal column. Serous fluid is the pericardial fluid, the pleural fluid, or the peritoneal. Pericardial fluid comes from around the heart, and the method to collect it is called pericardiocentesis. Pleural fluid is around the lungs, and the collection method for that is a thoracentesis. Peritoneal fluid is the fluid within the abdominal cavity, which is also called dialysate. Its collection method is paracentesis. Synovial fluid surrounds joints. The method of collection is arthrocentesis. Seminal fluid is the semen, and amniotic fluid is the fluid that surrounds the baby, and that is collected through amniocentesis. Cerebral fluid is clear and colorless. It is a sterile fluid, and the physician will perform a lumbar puncture only if it's something serious that he wants to consider or rule out. Doing a lumbar puncture in general is a very risky procedure simply because of all of those nerves that run through there. So it does take training and skill to be able to do that. Some of the reasons for doing a lumbar puncture would be looking for meningitis or any sort of cerebral hemorrhage, to diagnose some neurological diseases like latent Lyme's disease or MS, to look for any sort of malignancy that could be in that meningeal layer. So sometimes certain cancers can spread throughout the meningeal layer of the central nervous system. So if they're looking for those abnormal cells, then they may do a spinal tap. Or to introduce any sort of drugs, like with a spinal block for surgery or epidural, or possibly to do some sort of like chemo or radiation type therapies for any of those cancers that could be within the brain or the spinal cord. The CSF needs to be transported to the lab immediately. Anytime any orders happen on a spinal fluid, it's considered a stat test. So they are always addressed immediately, because typically they're not doing it just for the fun of it. It's not easy for the physician. It's hard on the patient. There's a lot of risk. And if they're looking for something like meningitis, then it needs to be addressed right away. So it is considered a stat test. The function of the spinal fluid is to serve as a buffer. It kind of helps prevent any kind of trauma from the brain bouncing around, or if you get any kind of blows, it kind of protects that nervous system. It regulates the volume of the intracranial contents, so the volume of what's surrounding the brain. It provides nutrients throughout the central nervous system, and it acts as an excretory channel for metabolic products of the central nervous system, so it kind of helps with that waste process as well. Spinal fluid is different from other fluids like the serous fluid or synovial fluid because its selective permeability of the membranes and the adjacent tissue containing spinal fluid. And so this system is called the blood-brain barrier, and there's a fine line there between things that can cross that barrier and things that can't. So for example, like there are certain medications that can cross that barrier when you take the medications, and then something like perhaps some chemotherapies, it can't cross that barrier. So if there's treatment needed for anything in that area, it would have to go through a separate treatment. So spinal fluid is not an ultrafiltrate of plasma. It is an active transport that happens among the blood and spinal fluid and the brain in both directions that makes the concentration of it different than what you would find with plasma. So when collecting spinal fluid or examining spinal fluid, you always want to handle it with care. That's not something that you can easily recollect. So when you receive that tube to the lab, you need to make sure that, number one, you process it timely, because any delay that could destroy anything in there or cause any kind of erroneous results, you don't want that to fall on you. So it's always processed stat. You want to handle it with care. You don't want to just throw it around the lab or take the top off and leave the top off and leave it sitting on the counter to be knocked over and spilt. So always take care with it. Now when they draw the spinal fluid, they usually do it in a particular order. So tube number 1, that fluid typically goes to chemistry. So you have less risk of contamination for microbial elements or any sort of contamination from cells that could affect your cell count for red blood cells if it's a traumatic stick. So with that first tube, it doesn't really matter if there's a little bit of contamination in there, because you're going to spin it down and you're going to test for things like protein or glucose. And there are a couple of other things that you could test for in chemistry. But just to give you an example, with protein, with meningitis, it tends to be increased, as well as with hemorrhage, multiple sclerosis. But if there's any sort of fluid leakage because of that blood-brain barrier being damaged, then the protein would be decreased. With the glucose, it's decreased with certain things like bacterial meningitis. So this can help differentiate between bacterial meningitis and viral meningitis if they see that glucose level is dropped. Because remember, your chemistry test will be done on an automated analyzer and reported out a lot quicker than a microculture plate would grow. This tube number 2 would go to microbiology, because you've cleaned that site, you've gotten tube number 1, so if there was any kind of skin contaminant, then it should be passed by the time tube 2 is drawn. Tube 3 is typically for cell counts, which would go to hematology to do a cell count, and if there are any cells there, to look at those cells and see what the different cells are and do a differential type count, which is the same as what you would do with in hematology if you were looking at a blood slide. Tube 4 would be something like immunology or serologies. Depending on what the physician's looking for, he may not always draw all of those tubes, and sometimes they may only be able to get 1 or 2 tubes, especially if it's a pediatric patient. And then sometimes they'll also say that they want a cell count done on tube 1 and tube 3, because if tube 1 was really bloody, then maybe they want to compare it to tube 3 to see if the stick was traumatic. And in that case, there should be more cells in tube 1 than tube 3. So when we examine the fluid, we're looking for what it appears macroscopically. So what's its color, what's its clarity. Then we're also doing the cell count, so we're looking to see if it has white blood cells and red blood cells, and how many, because that can give an indication of what's going on with the patient as far as hemorrhage or any sort of infection. Then you will also look if there are cells, possibly do some sort of smear review, where you would do a cytofuge smear. So you can see here where there's a centrifuge that takes special cartridges. And if you look at that top image, that cartridge will hold a glass slide, and then on top of that glass slide will be that little white piece of absorbent cloth or paper. And the sample would go into the little funnel, and then it would spin in that centrifuge at a really high speed, and it would force all of that fluid to go against that slide. And so the cells would stick to the slide where the excess fluid would be absorbed into that little map. And then from there, you would stain that slide, and you're looking to do your cell count morphology. So you're looking for any sort of abnormal cells, and you're looking to see what different populations of cells are in that fluid. And with micro, they would make some sort of gram stain and look at that fluid to see if they see any organisms, any yeast, any bacteria. And then they would also culture it, and they could potentially do some other serology type tests. They could do, if they're looking for spinal syphilis, or if they're looking for, perhaps they're looking to do the antigen test to see if it's Cryptococcus that's growing inside of the patient's spinal column, if it's got yeast inside of that spinal column. So there are a lot of different tests that can be done, electrophoresis. So there's several things that could be done on spinal fluid. For our serous fluid, we're looking at the pleural, pericardial, and peritoneal. So the fluid in these cavities, again, is always considered sterile. So there shouldn't be anything in there. It's usually a very pale color, pale yellow, sometimes kind of colorless with just like a little tinge. But if you're seeing an increased amount of volume of these fluids, then that's called an effusion. So what we do is you draw the fluid off, the physician would draw the fluid off in a sterile environment and submit that fluid to the lab. So typically something like this with a very large needle, sometimes with your peritoneal fluids, there's so much fluid in that cavity that they actually use really large bags to put that fluid in. And so this type of fluid is a normal serous fluid is formed as an ultrafiltrate of plasma as it filters through the capillary endothelium, and this is called the transudates. Now the exudates is a result of some sort of inflammatory process. So when you get that fluid that comes out looking like this, where it's kind of cloudy, so that's not good. That's not good to see fluid looking like that. So for the transudates, we're looking for something that's kind of clear, very pale, there's nothing in it, nothing floating. The white cell count could have some low numbers, but typically, you're not finding anything in these fluids that are normal. And for testing for like protein and lactate, those are going to be low. Your glucose can vary based on what the serum level is. But with your exudates, they're typically cloudy, turbid, or bloody. So you can see an example of the transudates normal looking in the bottom image, and then the abnormal look at the top, where it's really dark yellow, cloudy, brownish. It could be old blood in there. It could be bacteria growing there. It could be crystals. So with things like this, the levels tend to get really abnormal. And so if you see something like this coming into the lab, you can bet you're probably going to see something in it. So our pleural fluid is what surrounds the lungs. So if you see in the center there, that lining between the thoracic cavity and the lungs itself, so it's kind of like a lining on the outside of the lungs, it can fill with fluid. And if you get an abnormal accumulation, it, number one, can be hard on breathing, but it is suggestive of something like congestive heart failure, where the body's not pumping like it, the heart's not pumping like it should. The pericardial fluid is the fluid around the heart, and you can see that in the upper image. So if you get too much of that in there, in order to make sure that the heart continues to pump like it should, then that fluid would need to be drawn off. And the same with the lung. You get that excess fluid, it makes it harder to breathe. That fluid has got to come off. Peritoneal fluid would be within the abdominal cavity. So you can see an image of that at the bottom where there's excess fluid. And so that fluid can kind of put strain on the organs, and so that fluid also needs to come off. So it's collected under sterile conditions with an aseptic type of technique where everything's cleaned before entering that site. You're using sterile needles, sterile collection devices, so everything remains as sterile as possible, because if there's nothing in there, you don't want to introduce anything. It can be done for diagnostic purposes, or it could be done just to prevent any kind of damage to the organs or damage to the heart, making sure that the heart can pump properly and making sure the lungs can fully expand when you inhale. When you collect those, depending on what testing is going to be done, it's going to be put into a specific tube. So an EDTA tube or your lavender tube, this is where you're going to do your cell counts and your morphology. So the reason why it goes into the EDTA tube is so that you can prevent any sort of clotting from happening with that fluid. Anything for chemistry would be drawn in something like a heparin tube, and depending on what you're doing, as far as if you're doing anything for micro, it could go into some sort of sterile heparinized type tube, but not always. They don't always collect any sort of anticoagulant for the micro department. So when we examine these fluids, we are looking for what it appears macroscopically, its color and its clarity. We'll also do cell counts, so we'll do a red cell count and a white blood cell count. And then you may make a smear and review to see what those cells are. And you'll do a differential count on those cells. You're also looking for anything that may be abnormal, any sort of tumor or cancer type cells. And for micro, they may do a gram stain and a culture. For chemistry, you're going to check for some of those abnormal proteins, maybe glucose, some other things that could potentially be tested for in chemistry. With synovial fluid, you are removing the fluid from around the joints. And with this, normal fluid is an ultrafiltrate of the plasma as well. But the synovial fluid is a little different because it has the hyaluronic acid. And with that, it acts as a sort of like a lubricant for those joints, which allows them to move freely. Normal synovial fluid is a straw or slightly, yellow tinge to it, and it's usually very viscous. Synovial fluid differs from other fluids because it is very viscous, so it can have a little bit of a thickness to it. And you can also find crystals within the synovial fluid. So why would you do an aspirate of the synovial fluid? Well, number one, it could just be to reduce that amount of fluid that's on that joint, so to reduce that swelling. And number two, it could be to look for any sort of disease that could be within that joint, looking to see if it's crystal induced, is it degenerative, is it inflammatory, is there an infection. So you would look at the fluids under the microscope to look for things like crystals or gram stains to help kind of determine what's going on with that patient. And you could also see something like a lot of red cells, which means there's bleeding within that joint. The collection should be an aseptic technique. Again, everything should be cleaned. You should use sterile tubes to collect everything in. EDTA or heparin to prevent any sort of clotting, to allow you to do the cell counts. And you could potentially just do a plain tube depending on what procedure, what test is being done. Again, we're looking for color and clarity and the viscosity. You're looking for red blood cells, white blood cells, doing a count on those. And then you're also going to look at it under the microscope to figure out what cells are present and if there's anything abnormal. You would do a gram stain and a culture potentially, and you could potentially do some chemistry type tests. One of the other things that you will do will be to look for crystals. So depending on how the crystal appears under certain polarized conditions will help you figure out if it is a monosodium urate or a calcium phosphate dehydrate. And so depending on what you find, the type of crystal that you find can help determine if the patient has something like gout. So seminal fluid, once collected, should be tested preferably within 30 minutes, but no more than 2 hours, because as time goes on, the sperm tend to lose their motility, and that's one of the things that you look for when you're doing a semen analysis. So when it's collected, it needs to be collected in a clean container, and it does need to stay warm after it's collected. And so typically this is done to assess for things like fertility or infertility, forensic purposes, to determine if a vasectomy was successful, or to determine if the sample is suitable for artificial insemination type procedures. So when we do this, we're looking for the quality and the quantity of the seminal fluid. And so when you look for quality, you're looking for things like the viscosity as well. And you're also looking to make sure that the sperm look normal, that they're moving like they're supposed to, that they are still active after a certain amount of time, that they are shaped properly. They don't have two heads. You want to make sure they don't have two tails. So those abnormalities could be part of the reason for infertility. With amniotic fluids, of course, this is the fluid surrounding the baby, and it's mostly water, but it does have other things like proteins, carbohydrates, lipids, urea, electrolytes. And as you get later into the pregnancy, close to the end, it can also have a little bit of fetal urine in there as the fetus is maturing and it's starting to practice its own body functions, and it's not relying so much on mom to take care of those things. So what you would look for when doing the amniocentesis, some of the things might be looking for fetal lung maturity. So you're looking to see in cases where if the mom's in premature labor, you're trying to decide if the baby's born now, would the baby survive? Is the baby enough that we wouldn't have to do any sort of therapeutic measures once the baby's born. And you could also do something like checking to see if the mom is in premature labor. And so doing this, you would check the fetal fibronectin, which attaches the fetal sac to the uterine lining. And so if that starts to detach, or the mom's going into labor early, then you can detect that fetal fibronectin in the sample. Automated testing of body fluids is you're starting to see more and more of it in the lab, and it's starting to replace the manual method of using a hemocytometer. With the automated platforms, they have a separate mode on the machine for testing body fluids, and typically this is done on the hematology analyzer. However, if there's really low cells or barely any cells within those fluids, it makes it hard to do, so you really have to go back to the hemocytometer. Then there are some automated urinalysis platforms that also have the capability of testing these fluids and doing those cell count numbers, and in some cases actually giving some digital images of some of those elements.